Good morning. I'm Joselito Aidolot, and I'm here to present my topic, Privacy and Security of Healthcare Data in Cloud Computing. For the background of the study, the safety of data is one of the key issues about security and privacy in cloud computing. On these clouds, millions of users have stored their important data, which is make it riskier to secure every bit of information. Data security has become a serious issue in cloud computing. In various storage devices and machines, including PCs, different data is distributed. Servers and various mobile devices such as smartphones and network with wireless sensors. If cloud computing security and privacy are neglected, then each user's private information is at risk, allowing easy cyber breaches to hack into the system and exploit the private storage of data of any user. The benefits of the cloud computing give us have become an essential part of our lives. This is why if users want to trust the system again, protection and privacy in the cloud computing needed to take action. To be able to become part of the cloud computing environment, it is important to gain the trust of these users. For the gap of missing information, it is mentioned about future proofing, which means that it can still be breached into the future. Hence, those ideas must be updated from time to time. As effective as it sounds, the implementation and the monitoring are the hard part, which is not easy to maintain. Number three, budget and viability are also a missing factor, whether it is sufficient enough or not. For the statement of the problem, the Internet of Medical Things, IOMT, forms an ecosystem of linked sensors, wearable medical devices, and clinical systems capable of improving the quality of cost-effective and timely delivery of medical care. Cloud computing can be seen as an on-demand, less effort, and inexpensive technology in the current world, which involves many heterogeneous physical and virtual entities. While cloud computing has countless benefits, it also involves numerous data protection, data confidentiality, authenticity, and privacy issues. The biggest obstacle to the adoption of the cloud computing is stability. In order to secure the data stored in the cloud, this paper contains an elaborate analysis on different security problems related to the cloud storage, as an increasing number of variety of connected devices are added to the IoT generation. The potential security problems are increasing. Hacking, intrusion, data theft, various attacks, trojans, and malware transferred from one end system to another are the most well-known security concern of such technologies. Effective and efficient platforms that maintain data privacy are needed to be introduced as critical data are available that can theoretically be used for further research and currently uniformly distributed. The objective of the study, this study aims to improve on the security and privacy of healthcare data in cloud computing, specifically for it to become versatile and effective according to the papers to provide integrity to data that will be stored, and lastly for it become reliable, flexible, and safe for healthcare systems so that the people wouldn't worry about what will be stored in the cloud. For the significance of the study, in view of the fact that cloud computing plays an important role even in the medical sector, the result of the study will redundantly support society. This would also be a great boost to the future researches, awareness, thus a potential opportunity to build on the deficiencies in this paper. Workers on the medical field, this research would benefit those in the medical industry since the cloud is much simpler than storing data manually. Academic institution, sometimes they need medical records in order to look for your past illness. Companies, many business carry out a drug screening, so it's very effective for them to store information and look it up with ease. For the scope and the limitation, the general intent of the study is to understand how cloud computing can improve and provide privacy and protection for healthcare data. This research would also include accessibility, provide virtual storage space, and backup for healthcare to cloud computing, and to help companies save massive investment in data storage facility and technology. software licenses, servers, and hardware. This paper is an analytical study with reference to management's institution of the role of cloud computing in different sectors. The detailed review indicates that it is feasible to add cloud computing to management education to bring greater clarification regarding its advantages. For the related literature, these are the article that I'm used in this paper. So for the cloud-based data mining platform, so in this research, a cloud computing-based service-oriented architecture or SOA, in order to facilitate the development and integration of heterogeneous database and application system, as you can see in figure number 1. If any research team wants to access remote resources, the data or application, it merely requests web services to the SOA by applying the standardized programming grammar. In this figure number 2, so the cloud algorithm was used to virtualize the server with virtual machine where or the VMware in the platform. So it allows researchers to use the VMware to open a virtualized server to conduct the same research study at different locations. So different site researchers can share and transform outcomes via the virtualized server while keeping their original patient data in a local database. Also, we borrowed a technique called ambiguity that was proposed by Wang to protect both presence privacy and association privacy with law information laws. The benefit of this structure is that it has preserved original data, security, and privacy. While in this figure number 3, so the SOA and virtualization servers form a so-called cloud architecture, which allow researchers to easily share study resources such as patient health data, data mining application, and storage space through internet. In the cloud architecture, the data mining application can be viewed as a software as a service or the SaaS, and virtualization server as a platform as a service or the PaaS. In other words, this is very flexible model for enabling convenient on-demand network access to shared full of configurable computing resources that can be rapidly provisioned and released with minimal management effort or service provider interaction. For the methodology, in this model, cloud provider increase protection by storing more data in additional cloud systems. If a cloud storage provider fails, a backup cloud storage service is used to store customers' data on database so that if a hacker gain access to one of the data centers, they will not be able to access the entire encrypted data that is collapsed and stored in several data centers in another cloud. Separation of duties, availabilities, and fault tolerance are all covered by this model. Because there is a lack of information security by the information transfer among organizations, migration, reputation, and confidentiality are not protected. For the implementing procedures, the implementation of the proposed platform will include 4 steps as follows. Step number one, identify the service requirement. Step number 2, evaluate the deal with cloud challenges. Step number 3, compare different cloud providers. And step number 4, develop a follow-up plan. In conclusion, so cloud computing is a model for enabling convenient on-demand network access to share full of configurable computing resources that can be rapidly provisioned and released with minimal management effort or service provider interaction. Many managers, experts, and studies have suggested that it has the potential to overcome health data management analysis issue. However, few researchers have systematically studied the impact of cloud computing on healthcare IT, sample its opportunities and challenges. Based on the practical system implementation, in this paper, a cloud-based data mining platform for researchers in 3 different geographic locations for sharing healthcare research data results through internet, the main contribution of this study are: number 1, develop a cost-effective, flexible, secure, and privacy-preserved cloud-based platform for researchers in different geographic locations to allow for easily exploring diverse medical data for liver cancer research through the internet. Number 2, evaluate the opportunities and challenges of a cloud computing application to healthcare. Research data management and analysis through practical system implementation. The study can be used as a reference by other similar research to determine whether or how to migrate from traditional to cloud-based services. And number three, provide a practical international collaboration between academic institute and healthcare providers. So that's all for my presentation. Thank you.